Hi, this is Ruth calling from Glacier Dental, and I was just calling to let you know that it's time for your cleaning and checkup. Would you like to schedule an appointment? So I work at a local dental office called Glacier Dental. An average day at work is a combination of front desk duties and also dental assisting duties. What's really exciting and my favorite thing about my job is the dental assisting part. What that involves is interacting with patients, setting up for procedures such as fillings, root canals, involves taking a lot of x-rays, polishing people's teeth. Everybody loves getting their teeth polished. Yeah, it's really fun. Get to talk to dentists. I always learn so much when I'm just either with them, with a patient, and they're diagnosing things, and I just learn from what they're telling the patient. So the most common thing we see is caries. That's another word for cavities. It says here in the Alaska Oral Health Plan, caries are 5 times more common than asthma and 7 times more common than hay fever. Most people who come in have at least 1 or 2. We hardly ever see people come in with 0. What we do is clean out the tooth, put in a resin material, and it fills up that space and restores the tooth back to its regular shape. It's really funny how dentists are kind of trying to put themselves out of business. They're really advocating for people to take care of their teeth, floss, brush twice a day. One thing that can be so horrifying and just heartbreaking is when a young person who's about 20 years old, maybe even their late teen years, come in and their mouth is just totally destroyed and every tooth is just decayed down to like the very gums, and it's just so heartbreaking to see that because what we call that is meth mouth, and it's caused from doing drugs. We've had to completely pull all of a person's teeth and get them dentures as early as 25 years old, and it's just so heartbreaking. Having a beautiful smile is such an important thing in our culture. It's hard to even get a job if you can't smile. Thankfully, it's not common. Sometimes we see signs of oral cancer, and so we will refer patients out to their general healthcare provider. I'm a dental assistant right now, but I'm going to school to be a dental hygienist. So I'll have more of like a one-on-one time with my patients. I'll be doing the entire cleaning, and I'm excited to be able to have my patients come back and watch their progress and be able to teach them new things.